are you sleeping? Are you sleeping? I'm Dr. Shelby Harris, licensed clinical psychologist and director of sleep health at Sleepopolis, where we dive deep into all things sleep. If you like sleep talking with Dr. Shelby, take a second right now to like this video on YouTube or give us a 5-star rating through Spotify or Apple Podcasts. It seems simple, I know, but it helps us reach a lot more people to get them the rest they deserve. And if you're tired of hitting the snooze button, hit that subscribe button instead. A new episode of Science-Backed Sleep Tips is available every other Wednesday. As we all unfortunately know, cancer is a major disruption for everyone in its wake. But whether we're dealing with our own diagnosis or that of a loved one, there are tools and methods for improving our quality of sleep and our quality of life, from the initial diagnosis through the treatments we choose to pursue and beyond. To learn more, we've invited Dr. Eleonora Teplinsky, medical oncologist, professor, and fellow podcast host. The head of breast and gynecological medical oncology at Valley Mount Sinai Comprehensive Care Center, Dr. Eleonora focuses on young women with breast cancer, survivorship, exercise oncology, and the use of social media in oncology. As the host of the Interlude podcast, where she shares stories and experiences of those affected by cancer, she aims to empower patients to truly understand their diagnosis, providing support, inspiration, and strength to many. Dr. Eleonora, we are so glad you could join us today and to empower our listeners to better understand this important, far-reaching topic. So thank you for being here and welcome to Sleep Talking with Dr. Shelby.
Thank you for having me. It's great to be here.
So we really want this episode to be a resource for anyone dealing with a cancer diagnosis, the patients themselves, but also their loved ones, those in their support system. And while some of our listeners might be all too familiar with the effects cancer can have on our lives, there's also people out there facing this diagnosis for the first time. So for everyone out there, can we start by going over the common ways that cancer can affect your sleep quality? How does, let's say the pain, for example, how does the pain associated with cancer interfere with sleep? And what are some strategies that some people might use to help them get better rest that you've learned throughout your time?
Such an important topic. I mean, I will tell you that the majority of patients that I see on a daily basis are all struggling with some sort of sleep disturbance. And there's so many ways that cancer, even a diagnosis of cancer, let alone the treatment, can impact sleep. So just to go through some of them, I mean, the biggest one is the impact of cancer on mental health. And then that, one of the things that we see, then it impacts sleep in so many ways, but, the anxiety, the grief, the depression, the fear of cancer recurrence. I mean, all of these things, really, really impact someone's mental health. And then that impacts their sleep. They're having a hard time falling asleep. They're waking up in the middle of the night. They're not getting restorative sleep. So they're sleeping, but they're waking up still feeling exhausted and fatigued. I talk a lot to my patients about not the social media scrolling that happens at night. And, there's a lot of good on social media, but there's a lot of also triggering content and information that then impacts their sleep. So, mental health, by far the big one. Another thing that we see, of course, is pain. Some cancers cause a lot more pain than others. It depends on the type of cancer and the stage and where the disease is located. But obviously, if you're experiencing pain anywhere in your body and can't get comfortable, that's going to impact sleep. Another thing that we see, and I see this often in my world, is early onset menopause, premature menopause, then the medications that we put people on. So that low estrogen state makes it really hard to, people are just not finding that their sleep is restorative. They're having trouble falling asleep. And a lot of my women are waking up multiple times a night to go to the bathroom, and then they can't fall back asleep. So we see, the urinary problems play a role as well. So those are just, some of it. And I think what we always try to do is, go to the root cause, right? So if it's mental health, we talk a lot about okay, how do we manage that anxiety? Things like journaling and
Okay.
meditation, and we can dive into all of those seeing a therapist. But obviously, there's also sleep supportive medications that some of the patients need to be on. But we really try to figure out what's the root cause of the sleep disturbances before we just throw medications at them.
What about just the thing that I see a lot is fatigue. So a lot of patients with cancer are just reporting just extreme fatigue and then dozing a lot during the day or even just not even feeling like they can do much. So then their battery isn't being charged essentially, or they're not using their battery to need to charge it as much at night. So how do you manage the fatigue in a lot of patients?
Yeah, fatigue is a big one. So if you're undergoing chemotherapy, fatigue is
Yeah.
one of the most common side effect. And so I try to tell patients, it seems they always feel like it's counterproductive, but I tell them to exercise. And they're like,
Mm.
"I'm tired, right? Why are you telling
Yeah.
me to exercise?" But we know that movement, I say even 10 minutes a day, we know that movement really helps manage some of that fatigue and it does help them with better sleep. So we always try to talk about, can you get out for a 10-minute walk? And it can be, I'm going to walk to the end of the street and back. And if I feel better, maybe I'll do a little bit more. But that's a great way to try to manage some of that fatigue. Sometimes it requires a dose reduction or treatment interruption,
Huh.
depending on their fatigue. The two questions that I ask to try to really get a sense of what their fatigue is like is number one, at the end of the day, do you feel just so exhausted and drained? That thought of, I
Yeah.
just sat down on the couch and I cannot get up. So, more than what would be kind of a normal day, like I'm busy, I had a lot to do. And then when they wake up in the morning, do they feel rested? So a lot of my patients will spend
Ah.
8 hours in bed, but they wake up and they're not right. They just don't feel rested. So that kind of tells us that the fatigue is at a point where we really want to intervene. Anemia, a lot of our patients have low blood counts, so they're anemic,
Mm.
and that's going to cause fatigue, and that's going to impact their sleep. Other, electrolyte, liver abnormalities, all those things also can cause fatigue. And then a lot of the medications that we give in the survivorship period, kind of the maintenance medications, also can do it. So it all plays, it's like a perfect storm. And I'm sure you've seen and talk about this all the time. You're anemic, you're fatigued, you took a nap during the day, then you were anxious at night and you were seeing something, and then it's like, it all comes together.
Right. So there's a balance of needing to rest during the day, but at the same point, like you said, if you can't get off the couch, if you can't move, if your sleep isn't restorative, then it might be a sign that something needs to be adjusted. And when you say adjusted, like are you talking mostly about chemotherapy or something else?
So it's typically that, if we think that it is a medication, whether it's chemotherapy or targeted therapy, but if we think it's medication
Hmm.
related, that your fatigue is coming from medications, then sometimes we can lower the dose of that
Okay.
medication and see. A lot of it, this is where it's really important for patients to be really honest with their oncologist. I think sometimes people downplay the symptoms a little bit, and so you're not getting
Okay.
a full picture. But we definitely can adjust the treatment. Sometimes we'll take a break from the treatments for a week or two just to let people kind of recover. And obviously, it depends. The stage of your cancer and where you are in the treatment process really impacts it. Someone coming to the end of their chemotherapy is going to be more fatigued. They've just gone through months of
Yeah.
treatment. Someone with stage four disease who's going to be on treatment kind of indefinitely, the fatigue becomes a huge issue, especially with where the disease is in their body. So there's so many factors.
Do you find radiation to be a cause of fatigue in a lot of people? I've had some people report that, but I don't think people talk about that enough.
Absolutely. Fatigue is one of the
Okay.
side effects of radiation. And I think the part that we don't talk about often enough is that it often comes after all these other treatments. So it's
Yeah.
depending on the cancer, but let's say in breast cancer, typically you've had chemotherapy, you might not have, you've had surgery, and now
Yeah.
you're adding radiation to it. So it's building on this tidal wave already that's been happening. And so it kind of just further exacerbates it. People always think, well, radiation's just to one part of my body, but it has systemic impacts as well.
Tell me a little bit more about your area of specialty within oncology. So, how do the patients kind of present to you a lot of the times? And like you were talking about with the medications, what medications do you think are the things that really do impact sleep the most for patients?
So I treat breast and GYN cancers. So
Yeah.
we talk about breast cancer. Breast cancer mostly, majority of people are picked up on a mammogram. So you go for your routine mammogram
Yeah.
and something is picked up. And a proportion of patients feel a mass and then they go for a mammogram. A handful of patients are diagnosed already with stage 4 disease, and that's sometimes they're coming in with new pain or shortness of breath or things like that that
Hmm.
prompt a workup. But for the majority of people, it's being diagnosed on a mammogram. And then treatment is a combination for early stage 1 through 3 breast cancer is a combination of surgery, and then sometimes people need chemotherapy, sometimes they need radiation. They're all not all,
Yeah.
all breast cancers are different. But when we talk about the most common medications we give for breast cancer, about 80% of breast cancers are hormonally driven, so they're estrogen or progesterone receptor positive, and we
Okay.
want to essentially block estrogen from getting to a breast cancer cell. And those are the kind of classes of endocrine therapy, or some people call it hormone therapy, tamoxifen, aromatase inhibitors, that's anastrozole, letrozole, exemestane. And the two classes of medications work in a little bit of a different way, but they're with the aromatase inhibitors, you're putting people into a lower estrogen state. So they have to be in menopause
Okay.
to be on these medications. And then what these meds do is they block estrogen production in the body.
Okay.
So,
Okay.
and then
So, what does it talk to us about the estrogen blockage and what that might do for sleep?
being in a low
Yeah.
estrogen state is tough. And, a lot of for mostly we usually don't recommend hormone replacement therapy because these are hormonally driven cancers.
Okay.
But you can get, so a lot of people are getting night sweats, right? They're waking up
Yeah.
multiple times a night, changing their clothes, they're drenched in sweat. So that obviously impacts your sleep. The medications can cause fatigue on their own. They can cause joint pain. So people
Hmm.
are feeling achy. They wake up in the morning and they feel very stiff. And cause vaginal dryness, the genitourinary syndrome of menopause. So sometimes it can be frequent urination and they're waking up at night. And so all of those things, mood changes, and so
Yeah.
everything all kind of plays together, and insomnia just on their own, not even from one of these things. We see sometimes that changing the time of day that people take these medications can actually help them with better sleep. Mhm.
Interesting. So, what to change it from what, evening to morning,
Yeah,
or when do people typically take them?
so we find that sometimes if people take them, it depends. You have to kind of play around with the side effects, but they
Okay.
when you take them, it's a daily medication, but it takes several hours to kind of peak onset of the medication. So sometimes people feel they take it in the early afternoon, and by the time it's at its peak, they're ready to go to bed, and they're not sleeping. So I have some people who actually like
Yeah.
to take it like at night. It helps them because
Huh.
it helps them fall asleep because it's not hitting kind of until later in the a couple hours
Okay.
later. So it's a little bit of trial and error. But what I find is that these women are not getting good sleep. So then they wake up and they're achy, and now that's impacted their mood, and maybe they are tired, so they're not exercising. And then it's a spiral. So
Oh,
and
totally.
some people do really well with these medications. And I always tell patients that if you're experiencing these side effects, it's not your fault. It's not anything that you're not doing or doing. Everyone just handles them, their body reacts in different ways.
What sort of treatments would you use for patients kind of in this realm who are coming to you other than changing the medication time? You had mentioned medication. Are there other things that you might recommend when it seems to be kind of hormonally or pretty hormonally driven? Yes, there are other things that play in and they can't take or any sort of hormone replacement. So what would you suggest?
So yeah, I think that there's a number of things that we can try to do. There are some great medications for hot flashes and night sweats. So Veoza is a newer
Hmm.
one on the market, but that's really shown really good responses. So I
Yeah.
have people saying I'm sleeping better because I'm not waking up, with night sweats multiple times a night. Um, Tart cherry is a supplement that I love to use, because it is actually there's data showing that it can help with the joint pain from the aromatase inhibitors, but also it can increase melatonin levels. So
Yeah.
I tell people if you're going to take melatonin, you can combine it with tart cherry, and sometimes that helps.
Get
Find
a
the
double.
magnesium glycinate is something that people can help with. So trying to do more non-prescription medications, trying to
Hmm.
get a little bit more natural. Those all things can help. Now, the other thing is, we do vaginal estrogen often for our patients, because at least that
Okay.
is safe. It's not absorbed into the body, and that can help with some of those frequent nighttime urination symptoms. So again, trying to address each thing. And there are, of course, prescription sleep medications that much better than I do, and um, I try to get my patients away from taking the anti-anxiety medications at night
Yeah.
sleep, because I find that some people need them, but I find that if we can try to approach it from a more natural, okay, let's talk about therapy and journaling and meditation, because then it becomes hard, at least from what I've seen, to wean off the medications
Yeah.
later, and
Yeah.
long-term
And
use is not great.
right, addictive. They just
Mhm.
are.
Yeah.
So, and you just kind of get used to the
Hmm.
dose. So we even in sleep medicine don't like to use any of the anti and the benzos, the
Yeah.
more common benzos. But I think other things like CBT for insomnia or ACT therapy. There's like so many different non-medication approaches that do have evidence behind them, and I think sometimes people just accept that they're not going to sleep. But it sounds like there are ways to try and it might not be perfect, but ways to try and mitigate it as best you can.
Exactly. And, even if an acupuncture, is another great thing that we
Mhm.
do. I always tell people, even if we may not get it perfect, it
Yeah.
may not be back to where you were, but if we can even improve it by 10 to 15%, sometimes that's great. And that's
Yeah.
enough to get people feeling a little bit better, during the daytime.
Now, I'd asked, I know you saw it like on Instagram. I'd asked followers, what questions do you have? A lot of them were about the meds
Mhm.
for breast cancer, but then I got a number of questions of people saying that they were really concerned about sleep loss leading to cancer. And can you talk a little bit about that? Because I could imagine when you at the beginning of the episode, you mentioned about recurrence and anxiety about recurrence. So then if you're not sleeping, that can add into it. So how do you manage that or talk with patients about that?
So I think it's a great question. So not sleeping on its own is not going to cause someone's cancer to come back. Um,
Okay.
but it all plays a role in, again, we find that when people are not sleeping well, then it makes it harder to exercise. It makes it harder to take care of your body, nourish it in the ways that we need to. So it all kind of plays a role. But
Yeah.
I always want to stress that people are struggling with insomnia. That is not going to increase the chance of their cancer coming back on its own. But a fear of cancer recurrence is very real, and studies show that over 50% of cancer survivors experience it, which everyone I talk to says that there's no way it's only 50%. They feel that the number is
Yeah.
much higher than that. And, I think about, for some people, it can be very paralyzing. It drives their thoughts. It really impacts their day to day functioning. And that's where we really need to get support from specialists and mental health professionals. Some people, they recognize that they have a fear. It sometimes flares up maybe during a treatment anniversary or when someone else is
Yeah.
diagnosed, but they're able to, kind of manage it. So it's a matter of the severity and really seeking help. But yes, it plays a role in when you're not sleeping. And if you're having a hard time sleeping, and that's often at night is where all of those thoughts creep in. And
Yeah.
if you're already struggling with insomnia and then you're worried and you're nervous and you're anxious, it's just going to make it worse.
Right. So I think what's interesting is that you essentially said that sleep is not in a vacuum. It's when you're not sleeping, it does impact so many other things that we know can increase the risk of cancer in general, even just
Yeah.
cancer occurrence, not even reoccurrence. So I think people get so fixated on I'm not sleeping. And then it's like, what are all the other things that you're doing that could be improved that maybe would help to mitigate some of that?
Exactly. We don't have enough research on it to like, it's hard to measure, these
Yeah.
things. And we know that when you don't sleep, right, your body is reacting in a different kind of fight or flight, like
Hmm.
inflammatory way. And so how does that play a role? And we just don't know. And so I always tell people that to try to do, it's not always going to be all perfect, right? So most of us are
Right.
not having the days where we got 8 hours of sleep and we exercised for 40 minutes and we made three nutritious meals, right? Like, and we didn't scroll
Good
on
luck with
our
that.
phone and we drank all the water, right? Like it's like
I
no
know.
one's perfect. But even if to not get discouraged, okay, well, I didn't sleep, that means the rest of the day is shot, or I didn't work out today, so that's it, it's all done. And pick, small changes and small habits that you can do. So maybe, yeah, you didn't work out today, but maybe you're going to really drink a lot of water, right? Or you're going to eat a healthier lunch. So it doesn't have to be an all or nothing thing. And I think that's
Right.
where we struggle in the survivorship world is it's really hard for patients they have a new body, these new medications, they don't know what's normal, all the hormonal changes, and it's a lot. And then we tell them, well, you got to not, don't drink alcohol, don't
Yeah.
work out.
Yeah.
I mean, it's like everything. And on that note, let's talk about alcohol maybe.
Yeah. Please. Can we talk? I was
Mhm.
just going to
Yeah.
get there. So talk to me about that.
Well, I mean, so we know that all the guidelines say there's no safe amount of alcohol when it comes to cancer. Okay?
Okay.
So, alcohol is a WHO class 1 carcinogen. It increases the risk of many cancers, and it does so through many different mechanisms. It can directly
Okay.
damage your DNA. It can impact hormone levels. It can increase exposure to other carcinogens. I mean, there's so many different ways that it can do it. What I tell my patients is if you enjoy alcohol, we try to limit to about 3 drinks per week on average. So I
Okay.
want people to get away from, I need my glass of wine with dinner. I need my
Yep.
glass of wine to sleep. Um, and when
Yes. That's
I
the big one.
see, and I'm sure like you have many thoughts on that.
Oh,
Um,
yeah.
when I see my patients who are struggling with survivorship and being on these anti-hormonal medications, first thing I tell them is to stop drinking alcohol, because once
Okay.
they do, or have it maybe one drink on a Saturday, but you give it, most people who've given it up really say their sleep is better.
The hot flashes, I would think, are improving a lot too. Yeah.
Yeah. And, people say, but I need alcohol to help me sleep. And, we always tell them it's worse sleep with alcohol.
I know. But I mean, there's that idea too of like, I have to have alcohol to unwind, to de
Hmm.
stress.
Hmm.
Because I'm feeling anxious, I need to help kind of manage it with that. So, talking about the anxiety and I mean, depression, mood issues, mental health. So, what what point do you recommend people maybe see a therapist, or are there, talk to me about like just even resources for people who are survivors who kind of want to talk with others to kind of process a bit? Like where do you refer people to?
So there's a lot of really great resources, and there's so many that we don't even know about. I mean, there's so many people,
Yeah.
trying to help others in this space, which is wonderful. I really think most people would benefit from seeing a therapist who've been impacted by cancer, and that's not just the patient; it's caregivers. We don't talk a lot about
Mhm.
caregivers, but they really could benefit as well. And the problem is that there is a shortage of therapists. It's often
Yep.
not covered by insurance. People don't know, they meet one and that wasn't a good fit, and well, how do you find another one? So that's I think a big part of it. In the New York, New Jersey area, there's a company, Cancer Care, and they actually offer
Okay.
10 free therapy sessions to all patients impacted by cancer. It's it
That is
like
unbelievable.
huge. I'm sure now everyone's going to go there and be like, why do we get this
That's
place class?
wonderful. I'm totally
Yeah,
going to refer people to it's crazy. I'm a therapist in New York and had no idea about that. So,
yeah.
okay, that's a
So
great
it's
resource.
great,
What
and it
about like
helps.
groups? Yeah.
Yeah. so there's so many, I mean, I think social media, one of the good things about social media is that it's really revolutionized, what support groups used to, support groups used to be in person and
Mm-hmm.
once a week or whatever, and those still exist and they're wonderful, but you can find your own people in whatever you're struggling with online. So Facebook has a number of closed patient groups, and
Yeah.
depending on which disease type, for triple negative, they have a great TNBC thrivers. For the
Wonderful.
breast of us is a great one. The breast days. I mean, there's so many out there that it takes a little bit of time to figure out which community someone's going to feel good in, which, what
Yeah.
are their people, right? Um, but there's a lot of really great people out there. And what I love about survivors and thrivers is that they're the nicest people. They will talk to, they want to share, they want to help, they want to reach out. So it's, just sometimes hard for people to open up about and be
Yeah.
vulnerable about what they're going through. But when they do, there's a group of people waiting to take them
Especially people who've been there, who get it.
in.
That's the
Yeah,
key.
it's the lived experience. I find
Exactly.
that, and I will say my patients get so much information from these groups. There's for chemotherapy, we offer scalp cooling to try to preserve some
Mm-hmm.
hair loss. There's a scalp cooling Facebook group, and they go and they get these amazing tips. I had a patient who said to me last year, "Oh, this medication was newly approved," and she said, everyone in the group is saying that when they had a longer infusion, they tolerated it better. Now, I would have never known
Yeah.
that, and so we did it, and she felt better. And so there are all these things that just by talking to other people, it can help, and it can help manage some of that anxiety, because knowing that you're not alone, that other people are
Yeah.
struggling with the same things, I think that helps.
Yeah, I think social media, I agree. I think it's really revolutionized a lot of the field. I think it was very doctors. I mean, we are the experts for sure in how to treat and do what we need to do. But I think that patients can have a very valuable voice in helping and problem solving. Like I know with your podcast, and I know at least in sleep medicine, just narcolepsy, hypersomnia groups, apnea, right? So you'll have all these physicians who are putting people on PAP therapy, and then patients are having issues. But now there are other patients, there are podcasts, there are groups online of how to problem solve with how to use things and what to get the most out of their treatment. So I agree. I think it's really revolutionized a lot of the field to get the most out of what we need to. Tell us about your Instagram account a little bit.
So it's Dr. Japlinsky, super easy to find. I started it several years ago, mostly just because I felt like there was so much misinformation and people were
Yep.
getting not getting like good quality information. And I also found like there was so much I wanted to talk about with my patients, but you have 15 minutes. I didn't have time to do that. So I said, I'm just going to
Yeah.
put it online. And, it's really, it helps me a lot because I've really started to understand a little bit more about what people go through, and what they want to know. And I think it's made me a better doctor. And it's funny, as if you've been doing it for a while, right, you realize like, oh, back in the day I used to post this, right, and now I don't really talk about that anymore. Like I used to post like more
Yeah.
inspirational quotes, and I don't really do that
Yeah.
anymore, right? But like it's funny to look back and see like kind of the iterations of the social media. But I try to post things that to share people's stories, which is what I do in the
Yeah.
podcast, and to post education, science, the data, because there's so much misinformation. People are talking about, mammograms cause cancer. They don't.
Yeah.
That's a big one. And there's big accounts, right? There's the latest one. The influencers are saying that you don't need sunscreen, that sunscreen causes skin cancer. I mean, I don't even know where we got that one. Um, and but you see
It's
someone with a
mind
million
numbing.
followers, right? You think, well, they must know what they're talking about,
Right.
and like they have a million followers, and so in my little corner, that's what I try to do, is to combat some of that misinformation.
Which is exactly why I started mine too. It's hard. It's really hard to combat it, especially when people have a million followers, like you were saying. Like I get asked all the time, do women really need 1 to 2 hours more sleep than men and an extra hour when they're menstruating? I'm like, no, they need a little bit more, but not 2 hours more. It's not going to happen.
And
Interesting.
that's wow.
Oh yeah. Oh yeah, there's a lot and all these yeah, it's a big one and I'm hearing it more and more. And then if someone's struggling with sleep already and they're like, "I'm not getting an hour more
Yeah.
than most men and when I menstruate, why am I not getting an extra hour on top of that?" Like it's just going to make their sleep worse.
And like, who
Alas.
has time? Who has time for 2 more hours of
I
sleep?
know. That's what I often say. I'm like, "Where is that going to happen?"
I know. Oh my
Um
god.
Changing gears just a tiny bit,
Mhm.
I'm always interested, having worked at Montefiore in the hospital environment, and I think it's a big thing in sleep medicine as well, is that we're trying to work towards having hospital stays, inpatient stays, be a bit more sleep friendly and having treatments kind
Okay.
of timed
Interesting.
circadian wise.
Mhm.
Do you notice this when you have patients who are hospitalized? Like, how are you seeing that? And are any adjustments being made in the hospital environment?
So I love that idea. I will say no. I mean, majority of
Yeah.
my patients don't spend much time in the hospital. People are going home the same day, the next day
Okay.
after their surgeries. But people get admitted, and when they get admitted, it's often for symptoms. So now already, like they're
Yeah.
not feeling great, something's going on, maybe they have an infection, and oh no, like they're still getting woken up at 5 a.m. for their blood work, and everyone's coming in.
Yep.
We I will say the one thing is we just built a new hospital. And so the way they designed is that the nurses don't have to like basically interrupt everything in the room to give medication. So they can kind of silently walk in and like give the med. So if you're needing something at 3
Smart.
a.m., the lighting is a little bit better. So it is in that sense. But I find that patients, they want to go home. The first like sleep in the hospital is horrible.
Horrible.
It's horrible.
It's horrible.
And then if you want to take a
Okay,
nap,
so
everyone comes in and like interrupts you.
yeah, yeah, good luck with that.
Yeah.
Yeah, there are some hospitals that are thinking more about it and how to really make sleep happen in the hospital because it's restorative. It helps people recover.
Yeah.
So,
It helps with
okay, so
like,
you're seeing that. And I love that your hospital is thinking about that stuff a
yeah,
bit more. It's not perfect, but you're getting there.
getting there, right?
Um,
Baby steps.
what myths do you think you'd like to I mean, we were just talking about myth busting a
Mhm.
bit and things that you're seeing online. But is there other than the mammogram causing cancer, are there any other like big myths that you see going around when it comes to cancer and cancer treatment? Anything you think people misunderstand?
So I mean, there's a lot out there. I think that a lot of the myths are about radiation dosing and how that
Oh,
with scans in general. There's a lot of misinformation about screening and the benefits of screening, and there is a lot. I mean, mammograms and pap smears and colonoscopies and CAT scans for people with smoking histories, like all of those are really important. And
mhm.
periodically there's misinformation, a lot of misinformation about the HPV vaccine, which we know essentially eliminates cervical cancer as well as other HPV associated cancer. But there's so much misinformation
Like,
around.
what are people saying?
Well, it's just vaccines in general. And
Oh,
people
I see.
don't,
Yeah,
the HPV vaccine causes cancer, don't get the HPV vaccine. And it's challenging because it's recommended to be given around, in childhood. And so,
yeah,
um, but it really works. So those are some of the big ones. And then, things surface all the time that if you do this, you won't get cancer, this magic supplement, all of these
yeah.
things. And, if it sounds too good to be true, it is. Um,
Okay.
and I think, yeah, I mean, there's just a lot of, people will say, I've taken this supplement and my cancer didn't come back, a lot of holistic treatments. And I think holistic treatments
Mhm.
have a big role as a complementary treatment together with the medicines that we prescribe.
Makes a lot of sense. We talked about alcohol. Can you just briefly touch upon diet and how that might play in if we're thinking about cancer and recurrence? Like, how do you counsel people on that?
So we know that eating more plants is the best thing you can do for your body. So I don't,
Okay.
people don't need to become vegan. They don't need to be fully plant based, but a plant forward or plant predominant diet is going to be the best. And then also limiting red meat and processed meat. Processed meat is on that same class one carcinogen as alcohol. And so that's the bacon and the
Hmm.
deli meats and the sausages. And, especially in the summer, right? A lot of grilling. And
Hmm.
so you don't have to eliminate it. But again, what I want people to get away from is, okay, I'm going to have a burger with a beer every night. Those are special occasion things. So red meat, limiting that. because all these things contribute. And that's where there's a lot of controversy, especially
Mhm.
on social media. People will show them eating more of a ketogenic diet. And that has been shown to not be as effective as a plant predominant Mediterranean style way of eating.
Okay. So really Mediterranean or plant forward,
Yeah,
and they can go together.
they can
Okay.
go
Makes a
together.
lot of sense.
Exactly.
We like to end every episode with a segment that we call Something to Sleep On. So it's one last piece of advice for anyone looking to improve their sleep habits. So, thinking of all the things that we discussed today, and we did touch on a lot of topics, do you have any final thoughts for our listeners? Maybe something to sleep on?
I think the best advice that I can give is one, recognizing that sleep and fatigue and insomnia are very much, significant side effects from a cancer diagnosis and treatment. And so recognizing that it
Okay.
is normal is really important. But there are things that we can do, starting with what healthier lifestyle choices, like we talked about, limiting alcohol use, exercising, diet, mental health management, and then
Hmm.
addressing the underlying reasons that are causing the fatigue.
So, don't ignore it. Don't
Don't
self
ignore
neglect.
it.
Just do what you
Yeah.
can and do what you can and try and make it even a tiny bit better by working with your physician. So, Dr. Eleanor, thank you so much for being here. I think that this episode really has the potential to help a lot of people struggling with something that's understandably pretty terrifying. Thank you again for all the amazing, incredible work you're doing. Your Instagram is immensely helpful and informative. I learned so much from it. And thank you for letting our listeners know that they're really not alone in this diagnosis. So thank you.
Thank you for having me. Such a great, important topic, and I'm happy to be here.
Thanks for listening to Sleep Talkin' with Dr. Shelby, a Sleepopolis original podcast. Remember, if you're tired of hitting that snooze button, make sure to hit that subscribe button right now in YouTube, Apple Podcasts, Spotify, or wherever you are listening. And for even more sleep tips, visit sleepopolis.com and my Instagram page at SleepDocShelby. Today's episode was produced and edited by Ready Freddy Media. Our senior director of content is Alana Nunez. Our head of content is Molly Stout. And I'm Dr. Shelby Harris. Until next time, sleep well.